evening and a very warm welcome on behalf of the European Health Forum Gastein and the organisers of this session, #EUnite for Health Ecosystem, a Novartis initiated movement to foster innovation, sustainability and efficiency in healthcare systems across Europe, to this debate entitled, "Hey Mary, by the way, thank you for your data. Better data, bolder economy, brighter future." My name is Jackie Davis. I'll have the privilege of moderating this entirely interactive session with questions from me to our panel, and I hope later on from all of you. If you want to ask a question, please use the Q&A tab at the bottom of your screen, and please be as brief as you can so I can see at a glance what your question is and who it is for. If you want to exchange views with each other, with the panelists, with other attendees, use the chat box. And please, in the chat box, can you scroll down the drop-down menu and select all panelists and attendees so that everyone can see what you are sharing. And finally, if you would like to tweet about what you're hearing in this session, please use the hashtag for Gastein this year, #EHFG2021. So, as we are all very aware, data and digital technologies have played a key role in the response to the COVID-19 pandemic. And the last 18 months have shown just how vital they can be as enablers on the path towards a revolution in health services. So what are the key challenges that we need to address to realize their full potential? And particularly, how can we, going back to the title of this session, how can we confront mindsets, old ways of thinking? Can attitudes towards sharing health data be changed in order to unleash its full power? So is a robust, resilient, sustainable future out of reach? Or, to borrow from the title of this year's forum, Rise Like a Phoenix, is there a digi-Phoenix that can rise from the ashes of COVID and light the way to better health and therefore to better well-being and better wealth? Joining me today to discuss this will be Deepak Kalra, President of the EU Institute for Innovation Through Health Data, Birgit Bauer, a journalist and digital health and social media expert and patient advocate, and Brian Lehan Wong, youth officer at the Lancet and Financial Times Commission. Before I start to chat to them, we wanted to get a snapshot of your views to feed into the discussion, to find out what you think about the questions that I will be asking our panel. In order to do this, you need to go to Slido.com. You can either go there via the link that's just been put up in the chat box. You can use the QR code on your mobile device or the website code. And I'm going to read the 3 questions out to you now, but then we're going to give you a little bit of time to think about them. I'm going to read them out, and then I'm going to ask our panel an opening question. And then after that, I'll come and have a look at the results. So you've got 2 or 3 minutes, maybe a little bit longer, but don't wait too long to answer them. So the first thing we want to know, and we want to really know about your own opinion on the issue we're discussing. What is your personal willingness to share your health data for scientific purposes? Would you describe it as high, medium, or low? How willing are you to share? Second question, let's have a look at that one. What, if you are reluctant, what makes you most reluctant to share your health data? Is it the risk of individual identification? Is it the potential impact you might fear on employability? Might be the impact on your health insurance coverage? Mistrust that you might have in legislation? Or do you fear abuse of your data by the private sector? Or is there something that we have not mentioned? That's what makes you most reluctant. If you are reluctant, some of you may be very enthusiastic. So addressing those things that make you reluctant, our last question to you is, what would most increase your confidence in sharing data? Is it to be assured that you have full control over that data? Is it transparency over the use of that data? Is it the option to opt out from sharing data? Is it an assurance that there can be no negative consequences of sharing? Or is it something else? So those 3 questions: how willing are you? If you're not that willing, what makes you most reluctant? And what would increase your confidence? As I say, I'm going to have a chat to our panel, and we'll look at the results after that. So if you could vote in the next couple of minutes or so, that would be terrific, because I want to feed your answers to those questions into our panel, get their reactions, and maybe also ask them how they replied to some of those questions. So as I mentioned earlier, delighted to welcome Deepak Kalra, Birgit Bauer and Brian Lihan Wong. If you could now turn on your cameras and your mics, panel, and a very warm welcome to you all. Let's dive straight in. And I really wanted to just start by asking you, why does what we're talking about, Deepak, your institute, innovation through health data, why does it matter? Why is this issue so important? Because the title talks about a bolder economy and a brighter future. Why does data matter so much here in the health context?
Well, Jackie, thank you. I mean, the answer is very simple in that it does matter hugely, but why? I mean, I think most people in the audience will know that we are, as a society, we're aging, we're collecting more chronic diseases. There's a huge pressure on us as health systems to achieve better outcomes and to make sure we can achieve those outcomes with equity across all of society. But on the flip side, we have previously had strained healthcare budgets, and we know right now, post-COVID, those budgets are even more strained. There's a pressure on health systems to deliver better value and have less wastage. And I think everybody knows, but this is really Birgit's topic, so I won't say much about it, that we have to bring patients much more strongly into the system, empower them and let them make a positive contribution to healthcare. But that's your topic, Birgit. So look, how can healthcare become smarter? How can we optimize care pathways, care pathway delivery? How can we accelerate research into drugs, devices, algorithms, AI? The bottom line is that we all need to learn more from health data, all the data we can get at a multi-country scale. So we do need Mary, the person in our panel label, to give her data, but we need everybody else to as well, because we need that scale so we can have precise population data on not only rare diseases, but narrow profiles of disease. So we can look at people with a very specific certainty of condition and examine what their health issues are and how we can treat them, target therapies to them more effectively. Prevention as a final point. We need not only the data on the people who've got a disease, but the people who don't. So that means we need everybody's data. Mary plus, please.
And that's the key. How are we going to get that critical mass? And it'll be interesting to see what our audience have said about their own willingness, but also what makes them reluctant, what would help. Crucial questions to discuss over the next 40 minutes, 50 minutes or so. Birgit, from your perspective, Deepak talked about the patients right at the center of the system. Why is this issue of better data, so important for you as a patient advocate?
I think the patients in the center must have the voice, because they know what their needs are. And this is much important, because you can develop many tools, applications and algorithms for something, but if people don't use it, you will fail with that. And we have to, and Deepak mentioned that, we have very low budgets at the moment, and we don't have that much money to do something. So we have to share it in a wise way. And how could it better as to ask a patient what the needs are and what they want to have? Because it's also a question about quality of life. It's a question about disease management. Can I use a tool to manage my disease maybe better and have maybe more time for myself? And as a person living with multiple sclerosis for 16 years, I know what I'm talking about. And I have that big community in my back, and they say the same. They want to have tools which are feasible, which are usable, they are user-friendly. They should be also be manageable for a patient, because some patients have maybe not so much experience in using their tools, and they have to learn that. And this is the other point. We have to educate the people. We have to educate Mary, by the way, and all the other plus people, that they are coming to the table, that they raise a voice, and that they say, how would they share maybe their data, and what do they want? That's
Absolutely. And one question for a bit later on is whether they really understand at this point, that education point, why the data matters so much, how it all fits together. We'll come back to that in a minute. But Brian, I mentioned that you're with the Lancet and Financial Times Commission, and I was looking at your website before this discussion, and it talks about, says, we are in a world in which individual data is becoming one of the most valuable resources on the planet. That was talking about data generally. Why, in the context of health for you, is this issue so important? And maybe you could say also 2 words about the Commission and what you're doing.
Absolutely. Thanks, Jackie, for the question, and thanks to the organizers for inviting me to take part in this fantastic discussion. So, I mean, I think we've seen over the past few years that healthcare systems around the world are really changing thanks to the increasing adoption and integration of digital and data-driven technologies and services. So, to answer your question shortly, I think better data will be absolutely pivotal to delivering more robust, resilient, sustainable healthcare systems, which contribute to a bolder economy and a brighter future. And this is for several reasons. So, I mean, as Deepak has mentioned, in clinical practice, better data is enabling new treatments and therapies, as well as the delivery of more efficient and effective healthcare services. Look at the UK, for example. NHS data has been used to improve the overall performance of health systems and in research to discover problems in healthcare delivery and unacceptable variations between regions. With respect to when healthcare providers have access to patients' up-to-date health data, they can then use it to conduct predictive modeling to provide more efficient, higher quality, safer, and more personalized care for their patients. And as Birgit has mentioned, from that patient perspective, patients looking at their data and their health data over time can gain insight into how their health is evolving. So at the higher level, I think higher quality data can also help governments and healthcare collaborative networks with population health management, establishing early warning systems. It also allows governments and policymakers to make more informed decisions and processes, with respect to fueling, economic growth and productivity, which is what I suppose was part of that question. So, of course, with more and bigger data in the health data ecosystems, there's a lot of concerns around data analysis and interpretation. What do we do with all this data that we're getting and collecting? Things around data flow, data governance, secondary use of data, and data privacy, particularly as children and young people, like Mary, are being increasingly datafied and are undergoing data valence. So these are all topics which the Commission was established to explore, and ones I'm sure will come up later on in this conversation.
Thank you very much, Brian. Let's find out how our audience replied to those 3 questions. Now, you are all evangelical about how important this is, and therefore I would presume that your willingness to share your personal health data for scientific purposes, you would all 3 answer high. Correct me if you're not. But let's have a look, if we can, at how our audience answers that question. So we have a knowledgeable audience, we have a well-informed audience here, very high indeed. I'm just trying to, there we are, 46% said it was high, but interestingly, between high and medium, it was 46% and 43%. So not everybody resoundingly, and 1 in 10 of you say it's low. So let's find out what's behind those numbers, and particularly the people who voted low and medium. What makes you most reluctant to share your data? And here, the biggest issue is the risk of abuse by the private sector. Identification, is it anonymized or not? That's a big concern for almost 1/3 of you. Very practical issue, impact on your health insurance cover. Impact on employability, less so, but nevertheless, some of you mentioning it. Mistrust in legislation, very similar. Let us now have a look at what would increase your confidence most. So transparency, way out in front there, 4 out of 10 of you picking that is the most important issue. That control issue that we talked about. Interestingly, the option to opt out from sharing data, which is an aspect of control, very high figures, lower on full control of the data. That doesn't seem to be the biggest issue for many of you. An assurance that there can be no negative consequences, similar to the ability to opt out. But data usage transparency, the most crucial. Thank you very much for voting. Let's feed that into our conversation now. And I just wanted to ask you, panel, to react actually quite instantly to that in terms of what do you feel? Maybe we should start somewhere else and then come back to those results in a moment. We have a moment. I mentioned COVID-19 at the beginning. And I mentioned how everyone's become much more aware of digital tools, digital health services, and the data issue and so on. Brian, do you see this as a moment of opportunity? And if you do, what's the challenge to seize this moment of opportunity here?
I mean, absolutely. As I mentioned, with COVID, we've seen such increasing adoption of technologies and seen how better data can really facilitate stronger health systems and health infrastructures. I think some of these major challenges have been highlighted in these questions and in the responses to the questions that you've just posed to the audience with respect to trust, transparency in what's going to happen with our data once we do share it. We've got more data than we know what to do with. So how is it going to be used? So that raises these concerns around the governance of health data and data for health. So those are my responses.
Thank you. Birgit, for you, did anything about those poll results surprise you? And in terms of building on the momentum that COVID has provided us, and you talked about education earlier, it's been a real education for all of us in the importance of these issues. Is this a moment of opportunity?
I guess so, yes, because now we have, so one example in Germany, we had telemedicines, but it started to run during the pandemic, and people like it because it's more comfortable for a patient which is not mobile, for example. They can talk to their doctor very easily, but at the moment you can, this is the opportunity to grow that, to bring it on, and also to establish it in every aspect of health systems, not just telemedicine, by the way, everything. But this is a perfect example to see how it was growing and how we can move it forward. And we have to move it forward because people know the benefits now. And to cut it off and say, no, we stop because we're going back to our old traditional system. No, thank you. This will not happen, hopefully. And I was not surprised about the results, to be honest.
No, were they in line with how you would have answered in terms of the things that you are most concerned about?
I'm not very concerned because I'm using Facebook.
I want to come back on that point. I want to come back on exactly that point in a moment. But before we do that, Deepak, your reaction to the results. I mean, it was striking to me that I would expect an audience like this perhaps to be 80, 90% saying, yeah, I've got a very high willingness to share, but it's more mixed than that.
It is more mixed than that. And I have sympathy with the poll. There were some surprises, but you linked it to COVID. And I think what we should remember is that COVID-19 taught us about the importance of data, the importance of intelligence, and why it's really critical that we should be able to harness the value of data. But COVID-19 also caught us somewhat unprepared. We did not demonstrate, for example, across Europe, that we had a coherent approach to implementing good data protection in a public health emergency. We didn't have good ways of sharing intelligence. So I think that this COVID-19 has opened an opportunity for us to do more with data. The public sees why, but it also exposed the challenges. And I think that's reflected in the poll. What I felt from the poll is that the spirit was willing to make data available, but there were huge concerns about how it's done and how it's governed. People were anxious about the private sector. Well, the private sector is a very broad term. It covers all sorts of players. And what it shows is that people want greater confidence about how their data will be used, how they will be safeguarded when their data is used. And I don't think the poll teased that out, and it can't in a quick poll. But I don't think the COVID experience for the public has convinced them that our trusted organizations can be trusted yet. So we have an uphill battle to capitalize on COVID, if you see what I mean.
I mean, Deepak was saying that the public sees why. But do you think there is enough awareness? You talked about the need to educate Mary and all the other people. Do you think there is enough awareness about the link between the data that's provided, the analysis, artificial intelligence, healthcare, how all of these things come together? You know about it, you're a patient advocate, you're all working in this area. Do you think the public really understands why we're asking them to share their data? We'll come back to the Facebook point after that, but I just wanted to touch on this awareness of how important this is.
I don't think that the public has the awareness or the education to bring that things together and also to make conscious decisions. Because, and this is, Jackie, you know me for some months now, and I always say education is key and information is key, but there is no good communication about that outside, especially user-friendly communication, understandable communications. When we are talking about things like the European health data space or health data sharing, and that's things mostly we come together as an expert and we understand that technical term. But a normal citizen, a patient like me or Mary, by the way,
Mary
is not informed about that.
Let's not just talk about Mary, let's talk about Fred as well.
Yeah, yes. Of course, Fred doesn't know that maybe also because there is not that much information outside for the citizens, and this is what we need. And once we have this information outside, people can make their own opinion. And then you can also start maybe to convince some of them, and maybe some will not maybe very open to share their data anyway.
Absolutely. So, and Brian, I mean, you're the youth officer for the Commission. For young people, and I want to come back on why they're perfectly happy to share things on social media, but less happy here. But first of all, do you think that most young people who've grown up in a data-driven world understand it's important, and particularly in relation to something like health, which for many of them, they say, well, it's not a problem for me now, I'm healthy, I'm young, do you think we need to do more to help them understand as much as other generations why this matters?
Absolutely. And I mean, that's, as you pointed out, that's literally the title of our commission. It's about growing up in a digital world. And it's, children are, whether they have a choice or not, they grow up and they have this digital footprint that they're leaving, whether they interact with any service, whether, whenever they're using any platform. So, I mean, I think absolutely it's really key for children and young people to be more informed, to build this literacy around how data is being used. And something that we're looking at in the Commission is this intersection of digital health and civic literacy. So it's not just about knowing how to use digital technologies and data, not about knowing what things are being concerned about with respect to health, but also having that empowerment and that enfranchisement to actually then get involved in these civic processes around how their data are being used, to have a say in the governance processes that are surrounding the use of data and how they are shared and data flows.
Thank you. And Deepak, from your perspective, and it's interesting because we have questions already about why the reluctance, and someone says, how does the general trend of rising distrust in institutions and governments translate into how we look at health data? And that links to something I wanted to ask, because Birgit said earlier, I'm not worried. I'm on Facebook. If I'm on Facebook, why on earth wouldn't I share this data? I think she was trying to say. How do we explain the difference in particularly young people's attitudes to what they will share on social media, what they will share for their leisure time, for travel, and what they'll share for something that could save theirs or other people's lives? How do you explain that?
You're asking me, I think, Jackie.
I am, yes.
Well, actually, in a way, I would prefer not to answer your question precisely. The motivations for why Birgit is happy to be on Facebook are something that she'll tell us about in a minute. But I don't think we should be looking at that joyous sharing that takes place on social media or supermarket loyalty cards where the supermarkets gather all sorts of data about it and say, let's try and clone their magic and put it into health and see if we can get away with that. I don't believe that's the model we should pursue. I would prefer us to be honest with the public about how we are going to use data. There was that lovely chart, the middle of the three, that said, I'm anxious about data being shared with private companies. Well, if you asked me, private companies, I would express great concern. But the moment you said to me, it's actually companies that are working in the health sector, developing innovations to improve healthcare, and they will only be permitted to use the data for research or safety monitoring to improve the quality of their offerings to the health system. They won't be allowed to use it for marketing. They won't be allowed to use it to raise my insurance premium. They won't be able to use it to target me with ads. The moment you wrap this word private or private companies in rules about controlling and limiting what it's for the sort of purposes I would buy into, then I will say yes. My answer would have become yes instead of no. But it's not about copying Facebook or copying the supermarkets. It's about giving the public promises about what we want to use the data for, so they can be more confident when they say yes.
And you don't fear, as the questioner implies, that distrust in institutions and governments means that giving those assurances doesn't
Well,
quite
the trouble
work.
with governments is governments tend to say, trust us, we're on your side. And I don't honestly believe globally, I've seen in the last few years, at least from my reading of the news, any government that I would immediately say, I trust you. Sorry, there's not a country I can think of where I've watched in the news and thought, hey, that's a leader I would trust. Sorry to be offensive to the lot. Equally, equity of distrust. It's about having rules and bodies that are charged with upholding them. It's not about saying, I'm your government, trust me.
Yeah, and rules and guidelines of those things, Brian, that's exactly the sort of thing the Commission is working to develop, standards and so on. Why do you believe, I'm taking on board Deepak's point, he doesn't think we should copy the social media model, but there is this, particularly among your generation, very happy to share for fun things, but not so happy to share for saving theirs and other people's lives. What do you put that down to?
I think I would actually challenge that question. I wouldn't say young people are less likely to share personal information to save lives versus on social media. I mean, I think they very well might be sharing their data without even knowing. But there has been research in which young people, and particularly coming out of the pandemic, who have reported many benefits of their use of digital technologies for health. I think young people really appreciate the ready availability of information at their fingertips, opportunities to learn a lot about their bodies and their healths, and how to improve their health and physical fitness. They love being able to connect with peers, to find emotional support using social media platforms and other online forums. So they don't necessarily embrace the use of these kind of apps on a long-term basis, and can even become bored with them. But I think young people actually are willing to do so. I think it's
but
just
you were nodding when Deepak was saying we need to surround it. It's the rules. So there was this question about distrust of governments, and he said, well, yes, there is that distrust, but we need to make sure the rules work, the framework is there.
Absolutely.
And I mean, the work that you're doing in this area is to develop just that, isn't it?
It is, and it's also to develop health data governance principles around what is being done with this data once it is shared. So absolutely, frameworks are needed, ones which are commonly understood, ones which involve patients, young people, and the general public in their development as well. And I can touch on that later with how, for instance, the Commission's involved youth in the development of such principles.
That would be interesting to hear. Birgit, you answered right at the beginning when I said, willing that people's patients' concerns about sharing data. You said, what concerns? They're on Facebook. I'm on Facebook. Which suggests to me, I mean, do you find that among patients, there is this sometimes contradictory attitude, or are you as optimistic as Brian that certainly among the younger generation, no, people are willing to share for both purposes, and we just have to make sure the framework is right?
I totally agree with Brian, because we are using apps to train our brain or our body. We are collecting health data with different apps or wearables, tools like an iWatch, whatever. And then you share your data already. you are in that situation. And I think we need that framework, and we need to make sure that the data are really used in a very good and meaningful, valuable way, not just for fun or whatever. And I think a lot of people need, as Brian said, they go social because they want to know more, they want to have a peer support, whatever. And I think we have to differ it a little bit into pieces. We have the data, the health data collections provided by the government or collected by the government and the insurances, and we have the data collected on Facebook, and they are really public. And I saw a lot of patients sharing health data. You will never believe that. So, and most of them are not conscious about it. This is why I'm also saying the education must be there.
Absolutely. There's an interesting point from the audience saying, how can individuals like Mary make an informed decision on data without having a full understanding on the complexities of data systems, algorithms, and use? So can they ever be in control or feel in control? Deepak, I know you like to emphasize the word control of data over ownership of data. Can they feel in control? Because it's you need to be a data scientist to understand.
It's the holy grail question, Jackie, honestly. You know, in an ideal world, an individual person would be asked before their data is to be used. Maybe you would say, even if it's going to be anonymized, it'd even be nice to involve them at that stage. And that they would be told who's going to use it, why are they going to use it, how are they going to safeguard it, and what's the benefit from that use? What's the societal value going to come downstream? Why should I feel good about this data use? The trouble is, when we need data on hundreds of thousands of people, and when many companies and public bodies and academic institutions and university research teams and, you know, charity sponsored research groups all want to use this large volume of data, we could be talking about a data use every few seconds.
Yeah.
Well, we can't deliver that good informed consent and engagement at that level. It's just too hard. And that's why it's a holy grail question. So can we aggregate? Can we say, can we get the public to buy into certain categories of use? Can we get organizations to say you're allowed to use data for certain purposes and not others, so that we cluster things into meaningful batches where people can make decisions? But it would be difficult to do it at the level of every individual and every use of data.
But as you say,
don't think we can scale.
Ways categorizing and grouping.
Yeah, and then we start to come into patterns and rules as the tools for achieving that.
Birgit, is that the answer? Is Deepak because from your perspective, I mean, you're happy to share your data, but I don't know about you, but algorithms, etc. I'm not a data scientist. I don't understand a lot of what I'm giving my consent for, and nor do most patients, I imagine.
No. When you sign a consent, mostly you sign it, but you don't read it. Honestly,
it's a bit like the terms and conditions on
exactly. Exactly. And this is, yeah, because it's too long, it's too small font, maybe it's hard to read and to understand, whatever. And I think one piece could be, and I agree with Deepak, this is the holy grail question. You can't answer it very good. But what I would like to see in the future is also consent forms who are easy to read, easy to understand, and also easy for the people. You must not understand a complete algorithm. This is too much because it's not our profession, and it's not our job, but we must understand how the data will be used and why. And what I also want to have is something back. So if people or research institutes use my data for something, maybe to find out something about my disease, then I want to know this. And I want to have maybe something like a quarterly newsletter, a report, whatever. So when I give something, I want to have something back.
Yeah, I get that entirely. But when we're doing it on the huge scale that Deepak was talking about, is that possible to get something back?
I guess so, because people are always open, and patients, especially patients, want to learn more They need to know more about their disease. You don't have to know everything, but the most important key points must be given back in a specific way, maybe on a website, as a newsletter, a letter, whatever. But when I give my data, and this is my clear call to action, I want to have something back because they learn with me, then I can learn with them.
Brian, your reaction to that?
I mean, absolutely. I agree with what both my fellow panelists have said. I think, informed consent is absolutely crucial. I think individuals who contribute their data have complete full right to understand what data are collected, why they're being collected, the rights regarding accessing, changing, removing data from a system. I think they also need this clear understanding of how their data inform personal care and whether it may be reused for additional purposes. We talked about the secondary data use, for instance, and I think also then that leads to the right to decline further sharing of data, that this ability to opt out once they no longer want their data to be used, and then all in all, about this feedback loop, and it really is about instituting feedback and accountability mechanisms for those people who are using data, as well as for people whose data are being used. And I think inclusive and equitable and accountable health data governance really requires these mechanisms, where individuals or communities have the right to report data misuse, who can make inquiries into health data structures and processes, and as well as remove their data from a system. And that's really closely paired with this need for a broad understanding of data ownership and rights.
Thank you. This feedback point, Deepak, absolutely crucial.
Yeah, and I think that there's nothing to stop the feedback loops occurring in that broader way that I outlined about giving, defining the rules and the patterns of use, getting people to agree. What would stop? Let's just imagine the French Health Data Hub published in one of its newsletters in 2 years' time, calling all diabetics in France. Thanks a lot. Over the last 2 years, this organization has studied your data anonymously and so on. And we've got this new algorithm that helps to early detect hypoglycemic attacks and will cut hospital admissions for hypos by X and will reduce deaths by Y, thanks to all diabetics in France.
Easy to
We
do.
don't know
Easy
if your
to do.
data was in the set or not, so we're thanking you all anyway.
Just talking about the governance is a linked question, because we were talking there about how patients understand algorithms and all of these things. Another questioner says, how can institutions realistically keep up with technological innovation when it comes to health data governance? It seems like they're usually lagging behind the developments. How do we bridge the gap? Brian, in the work that your commission is doing, by the time I think you finish at the end of this year, it's been a 2-year initiative, things have moved on, things move really fast. So even for you specializing in this area, that's a challenge, isn't it?
I mean, absolutely. I think we are seeing that, there is this time lag between, when technological innovations, come into place versus, health data governance that then, kind of tries to retroactively govern these processes. And I think, a lot of this is what we actually are exploring in the Commission's report. And it's to really, as I said, set this framework for, okay, how do we're a bit too far gone now, in a sense that, these innovations are out there and they're here to stay. But now that they are here to stay, what can we do about it? What can we do, from now and in the future to protect, health futures, to protect children, young people who are growing up in these digital worlds, when the choice is already gone,
And it's interesting because I did want to come to the issue of EU policies in this area. It's a bit late in the day for a heavy discussion about directives and regulations, so let's not get into too much depth, but I think it is important. This is a very European data space, one of this Commission's key priorities, including in health. We have a question from Elisa Tamanen who says, I wonder if you know what are some existing EU policies or directives that can and should be applied in the European health data space. I mean, really, I suppose what I wanted to ask you here is how each of you, and Birgit, maybe start with you, how do you see the EU's role in this, and just how important or not the health data space, this being a way to make sure that we have access, we share optimal use of data, we foster a sort of single market, interoperability, we can all use the data and so on. How do you see the EU's role here, and how important could that initiative be, do you think?
I think the European health data space is a very important thing, and I would say we need it because we have to learn. And the EU role, yeah, that's a difficult question, because I think they have to bring up a structure and a framework for all EU countries. This is most important, that we all have mostly the same direction and the same framework, and also to keep the ways in data exchange clean and clear. And I think this is important, and the EU has to develop that.
Can that be done? I'm just wondering, are there any, do you think, cultural differences? Would you expect, if I asked those three questions that we asked our audience earlier, if I asked people in individual countries, would we get very different responses, do you think, Birgit, from different countries?
Yeah, absolutely.
So in that case, isn't it very difficult then to create a framework that really addresses it for everybody? I'm just, it occurs to me while you were talking.
Yes, of course, but I think that's one of the key things we have to do. And maybe we have to give the countries the possibility to individualize it a little bit, that it works within the country, but across the EU we need that framework, because data exchange will not work.
Absolutely not. And Deepak, our title of this event talked about Mary, but do you think if we'd been talking to Maria or Marianne in France, or whoever in different countries, we would have got, you were nodding when I said, do you think the response would have been different? And if there are cultural differences, how can we come up with this framework and really make it work, but in a way that is acceptable in different contexts?
Well, so let's start with some hope. Although there are differences across Europe, I would lay a bet that there are much more great differences planet-wide. So let us celebrate the fact that Europe is probably more consistent than many other geographies, and we therefore have a sporting chance. So let's not give up and say it's impossible. Let's instead try.
And indeed, therefore, because of that relative homogeneity, we could become a real world leader in this area, couldn't we?
Well, we could, and I think we should. I don't even think it should be hypothetical. I think let's just do it. Now, and I don't mean that entirely in a vacuous space. The European Health Data Space and European Commission have two roles to play here. The second one is to build us a European Health Data Space, which they're working on. But the first one is to be a focal point to bring our multi-stakeholder communities together across Europe to explore what should be good practice. The reason is there are already plenty of data spaces at national level, at regional level, some of them cross-border for rare diseases, for example. They've all got slightly different rules. They're not bad or good rules, they're just slightly gratuitously different because they were wheels invented by different people. So the EHDS is bringing people together. We are working across Europe to bring people together, and we find much more commonality than we find divergence.
Thank you.
I'm really hopeful.
Yeah, and Brian, you talked earlier about the involvement of young people in the work of the Commission, bringing them in. How do you do that, and how do you make sure that you reflect these differences in attitudes in different countries and so on, albeit given the relative homogeneity that both Birgit and Deepak were talking about?
Yeah, for sure. I mean, I think, this robust and secure EU health data space is long overdue. So just to set that up, Deepak's mentioned a lot of these potential benefits, related to, EU level oversight and these powers that, could really ensure a lot of these uniform technical standards. But I think, a really crucial part of achieving that bold vision that the EU has is really contingent upon harnessing the power of data for the greater good, and the greater good of, that is common to to everyone. And of course, this then raises a lot of challenges around, how disconnected member states might be from one another when it comes to healthcare. And I think this then also means that we need to address a lot of these underlying challenges to implement it effectively. I think smooth interoperability is really crucial to avoid, a future two-tier digital Europe. And with respect to involving youth, I think it's not just youth, but it's also, marginalized communities, vulnerable groups, anyone who might be interacting with this data space. And I think it's really perhaps not so much about the what, but the how. Any decisions that are taken with respect to this creation of the space without fully understanding end users' concerns and real world needs will most definitely result in this exclusive, VIP zone, as opposed to, a more inclusive European health data space.
And a question from our audience, or partly a comment really, saying if the framework was turned into an EC directive, leaving space for member states to account for these cultural differences, so that flexibility to reflect differences, would it work? Could it be binding? Could you have such harmonization? These are clearly difficult issues, but Birgit, I think you're very much pointing to, we have to do it. We have to build these systems if we're going to get the millions of Marys that we really need to make a difference. So we have to find solutions. I just wanted to come to the question of who does what. Who needs to do what? Because we've touched on it, and it was interesting in looking at how people answered the questions. There's a question which was directed to you, Deepak, from Sarah Mundia, who said, I understand your point on the fact that we need to understand the principles with which our data is used. We don't have the time to speak and explain it to everyone individually, but who should be the ones the people will trust? Governments, pharma companies? Who will believe them? Birgit, let me come to you. It was directed at Deepak, but I want to come to you first, because
that's a good idea.
Absolutely central question for patients. Who will patients trust? Who needs to do the convincing?
That's tricky, because patients are always a little bit skeptical, especially when it comes to the pharma companies. Could be a little bit difficult. What I would do is to let the people know that there is a framework. Maybe we need another framework or additional framework, especially for commercial or for companies, to help patients to understand that their data will not be misused or whatever. And I think this could be a solution. Also, and we have the government. So we talked about the European framework and the cultural differences. So we have there is a framework under construction, let me say it in that way. And I think the GDPR or also that frameworks are very common. Maybe we should think about some special frameworks for commercial projects and so on, to make sure that patients feel okay and are fine with that, to give their data to them too.
Deepak.
Well, it's interesting. The trust in the rule setting can be done by making the rules available, open access rules. Trust in overseeing the rules and applying sanctions needs to be by bodies that people regard as neutral, not having vested interests. So as a side remark, I'll say one of the things about the institute that I lead is that we're very involved in championing health data, but we don't have any data. We don't ourselves have any data, and we don't use data. But my institute's not accountable enough to take on this responsibility. We're not accountable. So the body has to also be accountable. Now, countries are establishing data permit authorities who might be the right bodies to play that role. And I think we need to see they're all a bit new. Finland has the oldest one, but it's still relatively new. That's possible, but we really need to see them in action. The public have to see them in action and learn if they can trust them or not. I hope so.
Thank you very much. Brian, to this point, who needs to do what and who can play the key role here in not only thanking Mary for giving the data, but making sure Mary feels comfortable about it and she knows what happened to it at that feedback point. How do you see the different roles of different players? A commission like yours bringing together stakeholders. How important are these bodies like yours in this process?
I mean, I think it's absolutely important. I think, to answer your question simply, everyone needs to be involved. There's a lot of finger pointing that happens when it comes to this space, and who's responsible and whose onus is it? And I think, as I said, to put it simply, it's everyone. Data governance principles for positive health futures really need to be clearly agreed upon and acted upon by all stakeholders. As you mentioned, our commission was established to explore this convergence of digital health and AI and UHC with the focus on improving and safeguarding health and well-being of everyone, particularly of children and young people whose futures are most impacted. So I think, having this broader dialogue with everyone, all stakeholders, with civil society, with end users of these data spaces is really crucial for the next steps.
Thank you very much. And I want to stay with you because I want to put you all on the spot before we end. And I'm going to go in the reverse way to ask the first question. So, Brian, I'm going to come back to you, and then I'm going to go to Birgit, and then I'm going to go to Deepak, and then we're going to hear some closing reflections and thoughts on our discussion. But, Brian, of all the issues we've discussed, and I go back to where we started, we had an audience that 46% of them said they had a high willingness to share, 43% of them said it was medium, and 1 in 10 of them said it was low. They identified some of their concerns, what makes them reluctant, what would increase their confidence. But of all the things we've talked about over the last 50 minutes or so, what for you is the most important priority for action if we are to achieve this better data for a bolder economy and a brighter future that the title of our session referred to? What's the key here, the most important key next step?
So, I mean, I really think this comes down to this solidarity-based approach to health data. The way in which we collect and use health data must really reflect the ways in which societal contracts in health and healthcare are articulated in different cultural and societal contexts. Governing digital health through this prism of UHC means that an approach to health and health-related data that is centered on this social contract that also applies to the digital sphere is based on and built on this notion of data solidarity.
Thank you very much indeed. Birgit.
I agree totally with Brian, and I would love to add to say we need that information, we need the framework, and all stakeholders must be involved.
Thank you very much indeed. Succinct and to the point. Deepak.
God, it's an impossible question, Jackie.
I know. Think of it
One
not as a
thing.
top priority, but a key next step. Where do we go from
No.
here?
The top priority absolutely has to be transparency. We will get the rules perfect if we iterate with society. So transparency has to be the thing. And it's not just a keyword. How do we achieve helping people to understand how we are using their data so they can react accordingly and help us to get the rules even righter and the governance righter? So it's how to achieve transparency rather than just uttering the word.
Which brings us right back to where we started, because when I asked what would increase your confidence most, it was data usage transparency, way out in front of any of the other issues. So goes right to the heart of the issue. Panel, thank you for a great discussion. And thank you. I don't know whether Mary is listening to us, and Mary now feels duly appreciated for sharing her data. But the key question, as we've all said, is how do you make millions of Marys? And I think you've given us some pointers to the way forward and why, crucially, it matters so much. Thank you very much, but don't go away, because I am now delighted to give the floor to John Olwell, who is Global Head of Digital Ethics, Risk and Compliance at Novartis, for some closing reflections on our discussion. John, thank you for having us this evening. Thank you for organising the session. Your thoughts?
Thank you very much, Jackie, Birgit, Deepak, Brian. What a fascinating, really inspiring conversation. I've learned a lot, and actually there are elements that I've taken out of this that we as an organization are going to apply. And one of them is being thankful to the people who entrust us with their data and just say thank you for helping us, and thank you to the society. I think that is really, really powerful. That appreciation is really powerful. So a few things that I've got out of this, which I think are quite important. I think Mary is willing to share the data. If you look at the poll, Mary said at least 46%, 43%, they are willing to share the data, but they are willing to share that data under a few conditions for the benefits of the society. That includes, we have to build trust. We have to educate and communicate very well what we are going to do with that data. And also that data should be for common good, and it has to be clear around that. I think building trust with the society is one of our key pillars as an organization. And we think by being very transparent and being very open on how we are using and going to use that data will help us build that trust with the society. Then I think a question of informed consent, I found that also very, very good, that at least consent should be understood. And we should also, by all means, try at least to ensure that that consent is not just small, that someone cannot really understand it, but at least ensure that it's really, really understandable. So as Novartis, actually, we have principles around this, whereby we as an organization is committed to use data and artificial intelligence technologies to empower humanity. Our aim is to empower humanity, and what Deepak said, in a transparent way. So it is for us about ethics. It's just not about legal, it's about doing the right thing. And that is anchored as well in our code of ethics. And with that going forward, we are really going to ensure that we live as per those principles as well, so that in alignment with what we have created, EU Unite at Novartis, initiated movement. For us, it's about sustainable systems and solutions with a vision to boost innovation, sustainability, and efficiency healthcare systems across Europe. The EU institution can accelerate all this. As we witnessed during COVID, data plays a really big role, and we really believe so, and we are going to continue investing in that direction, but very transparent with a lot of trust. Many challenges will have to be overcome, but the journey is that the direction started. So it is down to all of us to advance transformation challenges and opportunities. Therefore, we see EU Unite is there to support, to foster innovation and collaboration. And we are looking forward really to the partnership with all of you as several organizations across Europe, and the hope we count on your support to further advance this topic. So thank you very much, and we are really, really looking forward to build that trust, because I heard that we are not so trusted, but we are really working that you trust us. And through transparency, we will do everything to be trusted so that you entrust us with your data. Thanks a lot, and back to you, Jackie.
Thank you so much, John, and thank you for organising this session and bringing together such a brilliant panel. It has been great, and thank you also to the European Health Forum Gastein for hosting us this evening. I wish we had twice as long because there's so many issues I wanted to explore with you, but thank you for a great discussion. Thank you, audience, for your comments and your questions. It was great to get your input too. It only remains for me to wish you a very pleasant evening. Thank you all, and goodbye.
Thank you. Bye.
Thank you, Jackie.